This is CNN Breaking News.
This is such an awful mass murder.
26 injured.
The death toll is still rising.
Police were on the scene. There are 20 confirmed fatalities.
The shooting that occurred at that Walmart in El Paso, that we're told that 11 victims were taken to the Del Sol Hospital.
The morning of August 3rd, I'd actually woken up about 4:30 with an unsettling feeling.
It will always be a date that stands out in my mind.
You could hear the sirens as they approached.
From that point on, we knew that El Paso was going to forever be changed from this.
I received a message on my phone through our regional alerting system.
There was an active shooter was the first notification. Shortly after that is when they changed it to a mass casualty incident, and that we needed to start getting ready.
A young man from a small town outside of Dallas came to El Paso with the intent to shoot people and picked the busiest Walmart we have and walked through the front door and using an automatic weapon started unloading and shooting people.
I get a text message from my trauma medical director talking about the fact that there's been a shooting, and I'll never forget the note ends up saying, "This is the real deal."
The response from the hospital was magnificent. People just showed up. In the blink of an eye, we had enough people to be able to run 7 operating rooms and take care of the operations that we needed to do.
I remain and am so incredibly proud of the amazing team of caregivers that we have at Del Sol, the entire Del Sol family.
I think it speaks volumes for the people who work here and their commitment to the care and improvement of human life.
Even individuals that weren't called or weren't on the schedule just came and showed up to the hospital to see how they were able to help. Everybody was all hands on deck, whether it was from the highest level to the CEO, all the way to our amazing housekeepers. We were here to do one mission, which was take care of our patients.
The team of care providers that came together for these 11 patients was nothing short of exceptional.
We saw support from our sister facilities throughout HCA Healthcare in Texas, just sending staff. We had the therapy dog from San Antonio come out for a prolonged period of time, just demonstrating a different way to offer support to our team, which I thought was pretty cool.
In tragedies, animals really do lift people's spirits, and so it was really important, whether it was waiting rooms, whether it was other patients. Duke and the other support service animals always bring just a positive spin, and even if it's just for a few seconds, to be able to get away of what's really happening was really important.
I think that, unfortunately, most trauma centers have to be ready for this.
We drill for these types of things. We spend a lot of time working through different procedures and processes to make sure that when we respond effectively and efficiently to what the community needs.
If we hadn't done the drills, if we hadn't participated in mass casualty events, I truly believe that we would not have been able to handle this as effectively as we did. As a hospital, as a level 2 trauma center, we have to be prepared for the unthinkable. And in this case, the unthinkable happened, and I'm so grateful for our entire team that we were as prepared for this as we were.
If you let people do what they're trained to do, they will do it well and they will amaze you.
I always have had faith in my team. I've always had faith in everyone, but I had no idea what we were capable of. And I think August 3rd was a day of realization of that for me. I think that's the biggest takeaway. There's really nothing that I think we couldn't do as a team.
Staff never said no or I can't do it. They were ready. They knew there was a need and they just picked up and ran with it so that we had everything covered. That's the family I have worked with for 28 years. That is the Del Sol I know.
When we say, above all else, we are committed to the care and improvement of human life, it's never been more evident to me that that was exactly what our response to the events of August 3rd ended up being.